Hello, everyone. My name is Abhishek Mangaonkar, and I'm a assistant professor of medicine at the Division of Hematology and Transplant at Mayo Clinic. I'll be giving an overview of allogeneic hematopoietic stem cell transplantation, which is an aggressive treatment option for patients with leukemia and other blood diseases. This is often the only curative option for a majority of blood conditions. Not all patients are able to get a allogeneic hematopoietic stem cell transplant because it's a very aggressive treatment, and it is also associated with complications. Often younger patients are considered for an allogeneic transplant, often less than 65 years of age, although there are some exceptions to this. Healthy, fit individuals up to 75 can be considered as well. Disease control is very important prior to an allogeneic transplant. And by disease control, I mean control of the underlying malignancy. Oftentimes, patients need treatment prior to going for an allogeneic stem cell transplant. It is also a time-intensive process where there's a lot of preparation that's needed. The first step is to find a donor for the patients. The donor can be in the family, that's a brother or a sister, or it can be an unrelated donor where we go to the registry, international registry of marrow donors, and then try to find a suitable match. Haploidentical transplants and cord blood transplants are also becoming popular, especially haploidentical transplants where we can take a half-match donor, often a son or a daughter, and sometimes a brother or a distant cousin. They can be a half-match, and we can take them as donor options. In this day and age, the choice of donors for patients is increasing. More and more patients are candidates for this treatment. I'll go over some of the complications of this treatment, and this is the reason why we do not offer it for all patients. There is a significant chance that patients can develop any of these major complications. The most important one of them is graft versus host disease. This is basically a condition where the donor blood cells or the donor stem cells that are administered to patients can start attacking the body of the patient or the recipient, as we call it. And different organs can be involved: the gut, the skin, liver, lungs, joints, muscles, and they're broadly divided again into acute and chronic, where the acute graft versus host disease happens in the first 100 days, chronic beyond, although this timeline is also not definite. Acute can happen even beyond 100 days sometimes post-transplant. This complication is often life-threatening. It can be reversed only in about half of the cases with medications. Then infections, serious infections and sepsis can be a complication after transplant. Some patients can develop bleeding, organ failure as a result of several things, such as the chemotherapy that patients have to get prior to transplant. There can be several chemotherapy complications that are associated with transplant as well, such as mucositis, hair loss, nausea, vomiting, and again, organ failure, organ toxicity, among others. Due to these complications, it is critical to identify suitable patients for this condition. However, allogeneic hematopoietic stem cell transplantation remains it remains a curative option or a cure for a majority of patients with blood cancers and other blood conditions.